So tonight we are so excited to have Jessica Kahn here. And she and I have crossed paths many, many times, professionally and personally. It's not just a similarity of our names, but being a physical therapist and her being an occupational therapist. She has a wealth of knowledge. She's an adjunct professor down at the U. She's also the PT for Rowland Hall and Weileman. And she also is the founder of Blue Sky Therapeutics. So she's been working up here in Park City for 16 years, and she specializes in sensory processing disorders, feeding delays, and various developmental motor deficits. And so she is hands-on with not only her patients, but also her parents, providing education to them and tactics that they can use at home to help with their children. And not only that, but to understand what is typical and expected versus when should you seek help. So with that, I will pass the floor over to Jessica, and we can hear from all of her knowledge and clinical experience and all of her nuggets of good information for us. So thank you, Jessica.
Thank you, guys. And thank you for having me. I'm going to share my screen and you guys let me know if it's working okay. Okay, good. Okay, awesome. Okay, so like Joanna said, I've been working with kiddos for over 20 years, really. And something that I, come across all the time is, parents' questions and also misperceptions about childhood development and when is my child supposed to be doing this and why isn't my child doing this. And so a really long time ago, I decided to get into the world of sensory integration and what that all was. And the first thing I really want to talk about, if I can figure out how to use this, you guys, hold on. Let's move this bar over. Okay. Are those sensory systems. And a lot of times when you ask someone to name what the sensory systems are, they come up with those major 5 sensory systems: touch, smell and taste, visual and hearing. And that's it, right? Those are all of our senses. That's what we're taught when we're a child. And as we grow into adulthood, and we think that it stops there. And something that, I feel like a lot of people don't know about are the 2 major sensory systems that get overlooked as a child is developing, and then also as adults. And so those are not the only sensory systems that we have within our body. There are really 8 sensory systems. We'll touch base on that 8th one, 1, 2, 3, 4, 5, 6, 7. We'll touch base on the 8th one towards the end. But the 2 main sensory systems that are really important to think about when you are looking at childhood development are proprioception and the vestibular system. That proprioceptive system is responsible for body awareness. Okay, where am I in space? Where am I in relation to the things around me? Where am I in relation to myself? Where is my head in relation to my feet? Where is my hand in relation to the chair that I'm sitting on? So it's feeling, so it's that sensation of where you are in space. Okay, so taking that one step further, it's the information that your muscles and your joints tell your brain about where you are in space. Okay, if I'm getting a little biological for you, that is what proprioception is. Okay. The vestibular system, think about the vestibular system as the fluid in your inner ear, and it is responsible for sensing movement up against gravity. Okay, so can I sit upright for prolonged amounts of time? Can I walk without falling? Can I use both of my hands? And we're going to talk about in a second what that looks like as a baby is developing. But really, can I coordinate my body up against gravity? Okay. Do I have the sensation to hold myself up against gravity? Okay. So in the world of OT, those 2 sensory, in pediatric OT, I should say, those 2 sensory systems are the main ones that we look at. A lot of times with various disabilities, those two systems really can contribute to overall development, and not just with kids with disabilities. Very neurotypical children can exhibit issues with their sensory systems. And so we often look to these two major systems to find out what's going on. This last one, it's kind of newer in the world of sensory systems in occupational therapy, although been around forever. It's interoception. Can I feel the internal signs of my body? Am I too hot? Am I too cold? Do I have to go to the bathroom? Do I not have to go to the bathroom? Can I sense when I'm hungry? Can I sense when I'm tired? Can I sense when I need to go to sleep? Okay. So those are all the internal cues that our body tells us about when we need to give our body something: a coat, food, going to the bathroom, going to sleep, all of those internal signs. Okay. So let's break these down a little bit more and then kind of talk about what it looks like in development. I'm pulling up the slides here real quickly. Okay. So that proprioceptive system, as I mentioned, is body awareness. It's the information that our muscles and our joints tell our brain about where we are in space. Okay. The other piece that falls underneath that is force modulation. It's a fancy word for how much force do I need to execute a movement. So if I'm pouring water out of a jar, do I just flip the whole jar over? If I'm opening the refrigerator, do I yank it really forcefully? If I'm going to give my friend a hug, do I squeeze them super, super hard, or do I gently put my arms around them? So how much force do I need to execute a movement? Okay. The more I feel my body in space and where it is in relation to the things around me, the more I can feel regulated, the more I can feel calm, and the more I can pay attention. So you can kind of start to see where we're going with this in terms of children and kiddos that may have, underdeveloped proprioceptive systems, those movement seekers. And we'll talk about that in a minute. But when I can feel where I am in space, I'm okay. Like, I'm able to sit in circle. I'm able to sit at a table and listen to the teacher. I don't need to seek movement to feel where I am. Okay. So that vestibular system, like I said before, responsible for coordinated movement up against gravity. Okay. That's your head. Hold on. I'm moving these pictures over to the side. Head, neck, trunk, core stability. Everything is upright. I can play with my friends. I can engage with my family on the floor. I can sit at a table for a meal. I can sit at a table to do homework for a prolonged amount of time. So can I attend up against gravity? Okay. There are lots of developmental milestones that happen with this vestibular system that people don't realize all are hallmarks of that vestibular system. So something as an OT that we ask all of our families are, did your child crawl? And if they did, how long did they crawl? Or did they scoot? Or did they move right to pulling themselves up? And we're asking those questions because crawling is one of those hallmark moves of the vestibular system that allows a child to learn how to start to support themselves up against gravity. And we'll talk a little bit more about what that looks like and why those things are important. While a child is developing upright against gravity, they're also starting to learn how to coordinate their eye and their head movement. Okay. So for an infant, that looks like, again, sitting upright when I'm learning how to sit. For a crawling infant or a crawling baby, that looks like, am I able to lift my head and see the world around me and see the toys that are in front of me? And for school-aged kiddos, that's, can I sit at a table and watch my teacher and then look back down perhaps to a piece of paper or a project on the table? So coordinating eye and head movement and being able to separate out the two, also hallmarks of that vestibular system. Okay. So as a child learns to sit up, as a child learns to crawl, they also start to learn how to separate out sides of their bodies. And that's when we talk about hand dominance. So can a child who is crawling weight bear on one side while they're reaching for a toy on another side? Okay. The other thing about in the world of OT is tummy time, tummy time, tummy time, right? So we want our babies on their tummies. So they're starting to push themselves up with their hands. They're starting to lift their head up against gravity. And all of those motor movements are starting to develop. All of those motor skills are starting to develop. When we put weight in our hands, you'll see, you know, kids will lean to one side. Now we're rolling over. Now we're reaching with one hand and we're leaning on the other to weight bear. So all of these really, really important motor milestones are happening at this time and are hallmarks of these two sensory systems. Okay, this last one, or these last two, gravitational insecurity, those kiddos that get car sickness, those kiddos that don't like to be held upside down, thrown in the air, feet off the ground on playgrounds, those kids that are hesitant with that type of movement, all falls under the vestibular system. Can the fluid in my inner ear adjust so that I feel okay when my feet are off the ground? Okay, and dizziness falls under that category too. I had a friend from college who had a baby boy, could not figure out why the child screamed every time. He took him to the playground and he was throwing him up in the air. That's what dads are supposed to do, toss your baby up in the air. And this child couldn't handle that. And I said, well, let's look a little bit further into, you know, some of his sensory systems, because that's probably what's happening right now. Not every kid likes to do that. Not every kid likes to be off the ground in those positions. Okay. All right, so we hear this term sensory integration all the time. And if you're not an OT who's doing sensory integration, it's confusing. There's so many terms that are thrown out there that make zero sense to the majority of the world. And so having to explain it is also something that is very difficult, because a lot of times people are looking at you like, what are you talking about? I've tried to simplify it here. And so hopefully some of these things start to make sense. Okay. It is an umbrella of skills. Okay. And so I'm going to break down the main things that we want to look for as our children are developing. Okay. And hopefully I've simplified it enough. And if not, we can clarify things at the end. So there are three main areas here that I like to think of when I think of the big umbrella of sensory integration. Okay. Sensory modulation and defensiveness. It's the same thing. So sensory modulation is the inability to turn up or down the intensity of a stimulus. Okay. So these are your kids that are over responsive, oversensitive to certain input. We don't like to wear socks with seams on them. We don't like to wear underwear. We don't like to wear blue jeans. Our hair has to be a certain way. Our food has to be a certain way. Being in a crowded environment, no go. There are sounds that are sensitive. These kiddos have a hard time turning down the intensity of certain input, okay? And I like the word defensive because they are defensive and they exist in a flight or fight state most of the time. And in a few slides from now, we'll talk about what that looks like. Okay. The under-responsive kiddos need a lot of input so that they can engage. Okay. These are your, excuse me, these are your kiddos that need directions repeated a lot. These are your kiddos that are probably more lethargic. These are your kiddos that are probably more low tone, difficult to engage, shy away from different things because they need a lot of input to engage and to respond. Okay. The majority of kids I see in my practice in that fall under this area are the over responsive kiddos, right? Those kiddos that only want to wear one pair of pants all year round because they have a sensitive tactile system. Okay. Sensory seekers. Okay. And we also see these a lot. These are kids that can't get enough sensation, and they seek sensation because it feels good. They can't tell you that, right? They're kind of those kiddos that are labeled as behavior kiddos in the classroom, but they are constantly seeking out sensation. It feels good to them. It is calming for them. They are not being bad. They are not being aggressive. They are not it's not an attention thing, which gets confusing sometimes when you go to get children tested. They are sensory seekers. The more input they get into their body, the more regulated they feel. The more unregulated you feel, but the more regulated they feel. And they like to touch things, and they like to crash into things, and they like to hug you and touch and all of those things. Okay. Those are, how much do we feel sensation? Do we feel it too much? Do we feel it not enough? And just, do we exist in a world where we need it nonstop? Okay. That's one area. The next area are your sensory-based motor deficits, or your sensory-based motor skills, I should say. And those are really, fall under the two systems that we were just talking about, okay? If I don't have good body awareness, if I don't have good ability to be upright against gravity, maybe I have low tone, poor trunk stability, poor postural stability, I'm going to have a hard time motor planning. I'm going to have a hard time navigating a playground. I'm going to have a hard time navigating the aisles of a grocery store. I'm going to have a hard time navigating where things go in my bedroom, where things go in the house, organization. Okay. I'm going to have a hard time handwriting. Okay. Not only am I having a hard time sitting at a table, but now you're asking me to hold a tiny little object, and I've got to now coordinate my fingers. So a lot of times, these are the areas that I think people don't realize are sensory based. There's a sensory base to these types of skills. Okay. How is my posture? How is my balance? Am I a kiddo that always has his head down or her head down on the table? Am I one of those kids, you see them leaning on their head, they're flopping on the floor, all of those kiddos trying to be upright against gravity, to coordinate movement. Okay. Balance, we talked about with the vestibular system. Can I weight bear, or can I have balance on one side of my body and do something with the other side of my body? Or do I just have balance? Can I just stand on one foot and hang out here without falling over? And you can see how, if these skills are all compromised, there are lots of things in their world that start to become compromised, right? Like, mom just threw me on a soccer team, or now I'm having to do karate, and there are things that are happening, with those sensory systems that may be making those things difficult for some children that have these, issues. So, like I said here, using sensory information to move efficiently. So information, again, that your body is telling your brain about how to move efficiently. Okay. So that's the other piece. The last part is sensory discrimination. And I like this category because I also think there are a lot of, misconceptions with this. What does that mean, discrimination? We expect kids to be able to attend to everything that we are throwing at them, right? I mean, you're in a classroom, 20 some kids, you have a teacher talking to you, giving you directions. We're supposed to pay attention to that. And, they're supposed to pay attention to that and get that. So sensory discrimination is really what it says here. What do I pay attention to, and what can I ignore? Okay. So visually, are the lights really bright? And even though I'm in a classroom right now and you're telling me what to do, I am so distracted by these fluorescent lights, let's say. Okay. Your tactile system. This one can go both ways, and it can fall under that defensive area as well. I'm very, very focused on the feel of my pants right now. I can't pay attention to the teacher, okay? But also, if I'm holding a small object, so if I'm holding a pencil, can I feel that pencil in my hand well enough to move it around to learn how to color or to learn how to write, okay? So how can I discriminate what my skin is feeling? Same thing with auditory, and same thing with taste. Can I filter out what I am supposed to ignore? So you can see, based on some of these areas, how a lot of kids, let's say, who might have some struggles in these areas, go to their doctor, go to whoever to find out what's going on. And a lot of these may fall under attention issues, attention areas, attention deficit areas. So meeting that criteria is really, really specific. But I always encourage parents to explore where, where it's coming from. And whenever I do an evaluation, it's a whole sensory assessment that we're able to piece out. Is this just an attention issue? Or is there something else going on with a child's ability to discriminate sensation, to engage motor wise, or do they need to constantly seek sensation, which looks a lot like they cannot pay attention to anything. So unfortunately, and I wish people knew more about this, people knew more about this umbrella of sensory integration, because it contributes to so many areas of development and so many skills that I think, people don't realize the underlying base for a lot of these, a lot of the skill set. Okay, I could go on and on about that, and we will. So motor outcome examples. So fine motor skills, okay? So if I am able to be upright against gravity and I'm able to maintain a good posture, that means I have really good stability in the center of my body. When I have really good stability in the center of my body, I can coordinate movement further away from the center of my body, okay? So that's when we look at fine motor skills. So some of the things that we test are when a child is performing a fine motor task, are they using their entire arm, or are they able to just use their fingers and their fingertips, okay? So are they able to separate out that movement? Can they be stable through their center to coordinate further out with their hands, okay? That fine motor piece also is a hallmark of the vestibular system, like we talked about. When I'm learning how to crawl, I'm also getting really good input into my hands. And therefore, I'm kind of starting to figure out if I have a hand dominance. I'm also starting to figure out how to manipulate toys and reach for things. Those all fall under the category of fine motor, okay? Handwriting is a big one, right? We get weekly calls about kids that have poor handwriting. And this term dysgraphia, which is another session that we won't touch base on now. But handwriting is a major hallmark of all of those sensory systems working together. Can I feel the pencil in my hand? Can I coordinate my fingers? My visual system, right? Am I able to watch what I'm doing and be one step ahead of it as I learn how to form a letter, okay? So fine motor skills fall under all of those systems. Those systems have to be functioning to be able to learn how to execute so many different fine motor skills. And then you have your kiddos that have that defensive piece, right? I don't want to comb my hair. I don't want to take a bath. I'm very sensitive to those things. So a lot of times those skill sets fall behind because they haven't had practice doing those types of kind of grooming and hygiene, fine motor things. They don't want to do it. I don't want to wear pants that have a zipper or a button on them. Therefore, my skill set may fall behind because I don't know how to use, those fasteners the right way. Okay. Gross motor, again, such a hallmark of sensory processing and those sensory systems, right? So balance, coordination, navigating obstacles, negotiating playgrounds, negotiating classrooms, all of those things are hallmarks of body awareness and then being able to coordinate up against gravity, okay? And motor planning, which is what really we're talking about. Can I sequence a motor step, okay? Can I put two or three steps together to get from point A to point B? That's for fine motor skills, which is your hands. And that's also for gross motor skills, which is your whole body. Can I link together different movements? Okay. Okay, here's the big one that everybody wants to talk about. Okay. So often we get referrals for kids that have behavior challenges, that have learning challenges. And the big misconception is, again, that these kids are, quotes, labeled as being bad. They're being sent to different behavior specialists and whatnot. And I'm not saying there's not a place for that. There is, for sure. And I work very closely with them. But I encourage families, I encourage other professionals to get to the bottom of why a lot of these things are happening, to figure out if it's sensory related. Because in that little pyramid, you see that the base of all of these skills coming together are those three major sensory systems: proprioception and vestibular. And what I like to say about the tactile system is it's your first line of defense. So if you're a kiddo that is, oversensitive, and you're having to sit in circle time, and a kiddo next to you might rub your skin because he's really close, you might push that kid, or you might push someone in line who gets too close to you. So those three systems are the base for all of these skills. And I have a list here, which probably could go on, for different areas, or different, I would say, reasons for why I get phone calls. Those are really what I call the byproducts of all of these sensory systems working together. And, no, I would say that they're all is equally important. And we get referrals for all of these areas as equally as the next one. So the biggest one being attention, right? Is it truly an attention issue, or is this a kiddo that is a sensory seeker that can't sit still, that can't discriminate what he or she is having to pay attention to? Okay, so this byproduct is limited attention, right? You're going to get an email, a call from a teacher saying, we're concerned about this. So it is my hope, and that I encourage parents and other professionals to look at what the root cause is of this lack of attention. Okay. Anxiety is a big one. And I have to say, there's just been an increase of kiddos that are having a challenging time with feeling comfortable in their own skin, feeling comfortable in their own environment, feeling comfortable in their own space. And I could blame COVID for a lot of the increase, and I will. And again, that's another talk, but there really is an increase. And also, I would say, an increase in the age that this emotion is starting within kids, right? So if I don't feel comfortable in my own skin, if I don't like input into my skin, or their sounds are too loud for me, kids around me, or it's too noisy, it's too chaotic, I'm not going to be really happy in my environment, right? I'm going to pull away. I'm going to have anxiety. I am in a flight or fight state. And so a lot of times, again, this anxiety is the byproduct of a kiddo that could be having a hard time navigating sensation, making sense of sensation, and being able to be around all of these different types of sensation. You're not going to have a kiddo at 4 or 5 that comes up to you and says, I can't feel where my body is, so I just need to move right now. And so the hope, again, is that we educate professionals, we educate teachers and parents that it's a real thing. And so we want to give younger kids the terminology and the verbiage and the logo to actually say those things, right? And to describe how their skin may feel when you put on a certain pair of pants. And the thing with kids that do have anxiety as a result of sensory issues is that they start to control and manipulate their world. And by the time that happens, that's when I'm getting phone calls, right? Like, we are walking on eggshells around this family member so that their world can feel comfortable, but our world is very difficult. So that's when, there's a lot of parent intervention and discussion around how to handle that manipulative, situation that can occur with kiddos that have, sensory issues and anxiety from sensory issues, right? We have to get up and we can only cook a certain thing. We have to talk a certain way. We can't go over to this person's house, and those types of things. They really do start to take control. And as a result, and as you should as a parent, you want to create a comfortable space for them, and you want their world to feel comfortable, and you want them to be happy, obviously, and feel secure. So you start taking all of these steps to control sensation. Okay, refusals. I would say, I'm keeping an eye on my time. refusing to do certain schoolwork, refusing to go certain places, and again, not being able to say why, this is something that I can't do. I'm only 4 or 5. I can't sit at this desk. This desk feels too high for me. This chair's too low for me. So something that we do as OTs is go into classrooms and help parents figure out space so that it's comfortable for everybody. But kiddos don't always have to sit at a table to do work. They just don't. There are many other alternatives for helping kids feel where they are in space and completing, what they have to do. Okay. Controlling the environment we just talked about. I didn't realize it was coming up, but that's something that is huge and that I see a lot. Because how can you not want to, help them control their environment? But then life does start to get a little tricky when you're having to do that. Okay. Self-esteem and confidence as these kiddos get older, and it might not be recognized that there's some sort of a sensory deficit, self-esteem and confidence with social engagement, social tasks, social activities that can greatly be affected too. I see this with kiddos that are being thrown in group sports that might not be group sports kind of kiddos, and that's okay. And it's hard to recognize that in your child at first. I see this with kiddos that, again, only like to wear, one thing and can't go to this restaurant. They really start to, quite honestly, internalize that and will start to feel bad about that as well. So that self-esteem and confidence area is a huge thing. Emotional regulation, it's a big one, right? So if I'm experiencing sensory input that I don't like, I go from 0 to 100, okay? And once I'm at 100, it's very challenging to get me to come back down. So also a lot of kids who are coming to OT for that emotional regulation piece. How do I handle my emotions in an appropriate fashion, right? So if there's something happening, if that I don't like, or sensations coming in, how do I not have this great gigantic reaction that lasts an hour? Also making the family's life really, really difficult. The other piece to emotional regulation, I would say, is defining sizes of problems. So with kiddos that are learning about their sensory systems and learning about sensation, realizing that they're not these great big problems, and they're manageable, and that we can give them the tools to handle all types of sensation. So working on that emotional regulation piece is very key. Another huge byproduct of all of these systems, social skills as well, right? So if you have a kiddo that doesn't like to be in crowds and doesn't, deal well in more chaotic environments, they're going to shy away from engaging in social activities. And as a result, those social skills, may or may not be hindered. Okay. And this last one, which I've talked to, I'm just moving my pictures over, which I've touched on before, these sensory seeking kiddos are often labeled as those kiddos that have, negative behavior or aggression. And so instead of really looking at what is the root cause for that, and listen, it's not always sensory, but I encourage everybody to take a look at the bigger picture and look back. I always have parents look back into early development. When I start to probe with questions about sensory development, often they'll be like, oh yeah, he didn't like to be swaddled, or, he preferred, to always be on his back, doing one thing or another. They're little key things that we as OTs try to pull out and encourage parents to start to look back to say, this is something that is sensory related, and it's not more than that. It's something that is sensory related. And we work really hard to educate teachers on that too, because, right, they're the ones who are with our kids a lot throughout the day and are witnessing this, this firsthand. Okay, I think that's it. And there are resources for everybody. What I want to say is my website, there's a book here that I think is really the Bible of sensory integration and breaks down all of those areas of sensory integration quite nicely. I give it to parents because it's really user friendly. and starts to explain different types of tools and interventions that can help a child. And it's such a vast area, and we have such a short amount of time, that my goal tonight was to explain these things and hopefully give you guys the tools to start to look at your child differently, or look at your child's development from another angle, to piece together what you're seeing or what you're not seeing, to come at it from a different angle, not so much to tell, give you a laundry list of how to handle it, right? That's what you go to OT for, but to start to get you to think about your child's development in a way that's not quite conventional, right? That you don't always go into the pediatrician's office and they're like, oh, I shouldn't say that. More so nowadays, you'll hear the recognition of sensory integration and how it can contribute to all of these different things. The STAR Institute is such a great resource out of Denver, and their website has tons of great information on, the various areas and whatnot. That is my website, Blue Sky Therapeutics, and that is my email. And you guys can reach out anytime with more specific questions. But Joanna, I think that's it.
Oh my gosh, Jessica, that was so, I love it. This is exactly why we have these speaker series, right?
I hope that like covered what you expected. I feel like it is such a vast area, and it's like, I hope I fit it in a user-friendly fashion that it can, again, like I said, just start to get people's minds jogging about, questioning where skills are coming from and what's going on with your child.
Yeah, absolutely. And it is so vast, but you're giving us lanes. I almost think about it like bowling alleys that used to have those bumpers. Anybody remembers that era?
True.
But like to give parents the spectrum and then understand categories, lanes, right? To be able to kind of decipher, because the more educated you are as a parent, even if you don't have the answers, you can go and have a more comprehensive conversation with the practitioner that you're dealing with, it, whether it's a pediatrician, whether it's an OT, but having a foundation to build from is so vastly important. I could talk about this for hours. I'm so fascinated.
I could too.
Katie did write, and you just moved on to the motor section. So I just want to read her. And Katie, feel free to unmute and jump in here.
Yes, please.
Since you're off camera, but she said, I work a lot with kids that are working on the sensory aspect. And we use sensory diet as a behavior therapist in the school setting. Mm-hmm. But I really struggle knowing the sensory red flags at home with my kids, one being a preemie. If I have concerns, what should I look for at early stages to do early interventions? I'm very familiar with K through 5, but can I recognize it earlier?
Yes. So you absolutely can recognize it early, and knowing the fact that your child was a preemie will clue us into specific things to look for. Katie, how old is your child?
So he's 15 months.
Okay. Okay. And when was he born? Like when was he born? Gestation? When?
He was 7 weeks early.
Okay.
So 33 weeker, spent 6 weeks in the NICU.
Okay. That was my next question.
He's crawling and like pulling up on things, but like really just not walking and not.
Okay.
Yeah.
Okay. So, and what I often with preemies, what I tell parents is you need to subtract that amount of month, whatever those amount of months are that he kind of went through that traumatic period, subtract that from his development. I also like to tell parents nowadays, no more textbook, my kid has to walk in a month, at a year, my kid has to walk at 16 months. Every kid develops differently. So for him, you're kind of looking at the right things right now. He's pulling himself up. He's starting to learn how to weight bear. I would start to look at his ability when he's on his stomach to right his head and hold his head. So we start to develop strength and stability within his neck and his trunk. Did he crawl? Did you say he crawled?
Yes, he's fully crawling like very quickly.
That's great. That's like the biggest thing that we want to see. So in terms of motor sensory, I feel like you sound like you're in a good place. Like you just want to continue to encourage him to weight bear when he's standing, reaching from side to side with his hands. And it's okay to still put him down, on all fours, to play with him on his stomach. All of those positions are still encouraged, even at that age. So the other piece to the world of being a preemie is that you're brought into the world in this very traumatic fashion, and then so much stuff gets inputted into your system between the lights and the tubes, and he was in the NICU. So a lot of preemies do have hypersensitivity, right? That inability to turn down the intensity of certain stimuli. So I would say he's young right now, but can you tell, like, you're looking to see if he minds different movement in different positions when you're holding him? Does he mind textures? Does he mind lights? Does he mind sounds? Anything like that are just things to pay attention to.
To watch and pay for now. Okay. And when, like, would you say at that, if I'm saying, yes, he's seeing, like, I'm seeing he has those sensitivities, that we reach out to gain more support?
Yep. Yes, because I could ask you 100 more questions right now, which I won't do on this platform, but I would ask you 100 more questions. So you can feel free to send me an email and we can walk through it. And if there are concerns that you have, we can touch base more specifically. But I mean, it sounds like he's developing at his own pace, which is okay, which is totally okay, you know, for a preemie. But pay attention to kind of some of those behavioral responses to sensory input. And then you'll let me know if it's something that you're concerned about.
Okay. Thank you.
Sure.
So much.
So Jessica, I have a couple questions, but one of which is, so we were just talking about like a 15-month-old, you know, what about, like, what age ranges do you work with? And then is it ever too late to work with patients?
Okay, that's a great question. I would say that I work with kids 13 and below. So tiny, tiny little babies, infants to 13-ish. And I would say that for sensory things, no, there's not an age cap. I feel like as adults, we deal with that kind of stuff. Like I always tell my students, to get through graduate school, I went through packs and packs of Orbit chewing gum because I had to have that. I just was chewing. That's how I paid attention. So we can all look inside ourselves and kind of be like, oh yeah, I have a sensory issue, or I don't like wearing a wet bathing suit, or whatever it is. So there is no age limit to, you know, to managing, to treating, to providing tools and intervention for sensory, you know, dysfunction. I feel as though it turns different when you're an adult, right? You manage it differently. Our teenagers, unfortunately, manage it differently. So as soon as you recognize some of these signs, it's important to get the help that you need. But there's no age limit. Now, motor is different. Motor is different. I get a lot of 4th, 5th, 6th grade. I get 8th graders, and I get parents like, well, he doesn't hold the pencil correctly. And I'm like, I don't know that we're changing that right now at 14 years of age, at 8 years of age. So for some motor things, it's important to hit them when they're really little.
That actually, Jessica, is kind of translates well to a question I have, is just how many of these kind of more minor symptoms that some younger children may show are something that they'll just grow out of, or something that really needs more attention. Because my 5-year-old was super sensory defensiveness, like we had to wash her pants every single night because she wanted to wear the same ones over, and would literally go like stiff as a board on the ground, throwing a temper tantrum. And we kind of just worked her through it. And now it'll happen every once in a while, but not it was every morning. It would be an hour situation of getting her dressed. And now I'd say it's like once a month.
Yeah.
And she's worked through it, but now she's a year older. So how much of these things are things that is just age and they grow out of, and how much of it is like, I should be concerned, what should we do?
It is so kid specific. And I know that is not a helpful answer. Okay. So what I see, especially with kiddos that have sensory defensive tendencies, it ebbs and flows. So, and I don't say that to scare you, to say that it might happen again, but kiddos that are learning to manage it on their own do learn to manage it, and they whatever tools they're using, that's great. And there are times when it will disappear for 2 years, and then all of a sudden they're sensitive to something else. Now they're more mature, they're more able to communicate, and it might not be this crazy tantrum throwing the entire family off. But I would say that those types of sensory issues, they ebb and flow throughout life. I mean, they do. And so there is a spectrum of severity as well, right? Like I see kids that literally cannot leave their house. I see kids that will not get out of the car to go into school. So those are kind of your more immediate, situations. And it's also parent specific in terms of what I say to parents are, how are things at home, right? Every child's going to do great when they come to OT because OT is fun. You're getting good sensory input. You're having a good time. You're on swings. You're playing. Of course, your behavior is going to be good with me. So I always check in with parents and I gauge, is this manageable for your family right now? Or is this something that feels like it's an absolute emergency? And those things also ebb and flow, okay? Some of the more severe, and I hate to say this, but it is true, some of those more severe cases, those kids do grow up and they start to self-medicate and self-manage. And so when we start to look at our teenagers and our adolescents and kids that are struggling in certain areas or struggling with substance abuse, all of those things, a lot of times we do find, and there is research, it shows that those are sensory, based, there's a sensory based component to some of those types of things. But I'm not going to say that they don't necessarily, sometimes they do resolve, right? Sometimes kids mature and they're like, guess what? I can't have a tantrum in the grocery store. I can't have a tantrum every morning. I'm exhausted from this. It doesn't necessarily mean that the sensation is all better, but it might mean I need to figure out how to manage my emotions better.
Yeah. How often do you communicate with the pediatricians in Park City, and how much does that drive you wild? Because I feel like there's like a really big gap of these things that
Depends
maybe they do a great job of referring to OTs when they need to, but it kind of feels like literally none of this has ever come up in any appointments that I've ever had.
Am I allowed to say it depends on which pediatrician? Because I just said it. It depends on which pediatrician. And I kind of feel like I can just leave it at that. Again, because there's not enough knowledge out there about sensory integration and what it does and what it is the base of, what it is the foundation for. You are not wrong. I feel like, knowing what I know about sensory systems and how much our town has grown, I feel like there's not enough awareness of it. There just isn't. Some of them do know, and some of them have really gotten more on board throughout the years and make an appropriate referral. But you're not wrong. You're not wrong. There's not enough, education about it. Unfortunately, they're very medically based in terms of what is the code I'm using and what, do you have a fever, whatever. I don't mean that disrespectfully, but there's just not enough necessary, knowledge about the end products, the end behavioral, emotional, motor products of the sensory systems.
Mm-hmm.
Well, and that's exactly why we started Hive. But one of the reasons is because being a practitioner myself, I know that we're all like in our little silos, and we wanted to break down a lot of those walls and increase the communication to understand what everybody else does. And there is shared skills sometimes, right?
Yeah.
So in terms of, there's overlap between what one practitioner does and another practitioner, but
100%
is exactly why we want to have these conversations, is to increase that knowledge for practitioners as well as for parents. 2 questions.
Yeah.
So in the state of Utah, is there direct access for OTs? Do you need a referral?
So it's insurance, depending on your insurance plan, but no. Okay. However, some plans require prior authorization, and I'm well versed in any insurance plan. So if anyone has any questions, you just email me and I'll tell you what the hoops are to jump through various insurance companies.
Great. So contact Jessica for questions about that. And then second of all, when the first step is obviously just understanding the scope of what you do. I'm interested in parents understanding also the longevity, and obviously depends on the specific child, their symptoms, how many systems are involved, and the severity of those. But is this something that patients have to work on for the rest of their life, or with sensory integration, is it that they get to a point where they've managed and then it becomes integrated for that child and they're able to cope? Typically, you know, for a while, they might go through some regressions, it sounds like, depending on developmental stages and what they might be dealing with in the rest of their life as well. But can you speak a little bit to that?
Yeah, I would say that they do become integrated. They do, you know, anything that I'm talking about or that I talked about, it's neurological. It's a real thing. Those are real neurotransmitters in our bodies that are feeling sensation. So, you know, with neuroplasticity, of course, they come to a place where their sensory systems are manageable, are improved, their motor skills are improved, their ability to handle sensation is improved, right? I mean, that's why I do what I do, because I've seen it over and over again. It is treatable. It does happen. How long a kiddo is in therapy completely depends on so many different factors, but just taking OT, you know, by itself, 100%, these kids get better. They do better. They're happier. They're, you know, able to integrate into their world. Sensory integration is integrating into our world, right? Like, so helping them do that is a real thing and a real possible thing. Do they go through their life and things come up? Of course, right? Because there's so many, you know, factors, right, that contribute to that. But I would say there are times when I work with kids for a year and then I see them 3 years later because something, you know, they're in middle school now and something has come up. But yeah, I mean, they're good outcomes. There's research, there's good outcomes. Those 2 websites that I gave you, or the one, is a really good place to look into that.
Thank you so much, Jessica. Anybody
Welcome.
else? We've got 1 minute. We try to be respectful of parents' time.
Okay.
But if anybody has any questions, feel free to insert that now. But personally and professionally, I just want to say thank you so much. This was such a joy.
Welcome. I'm
You're
so
all-
grateful. I'm so grateful that you guys had me, and hopefully this reaches more people. And like, you know, Perry, you said, we start to educate the people in our community, the professionals in our community, and the parents.
Yeah.
Fantastic.
Thank you, Jessica.
You're
Thank you
welcome,
so
you
much.
guys. Have a good
We will
night.
be-
Thank you.
We'll be sending out an email with this
Much.
recording and
Okay.
resources for everyone. So stay tuned for that. And thank you again. And we'll catch you all next month for our next speaker series. Good night.
Good night.